And good morning. It is July 9th, 2024. I'm Dr. Deuk Majan. Our first case for the day is a patient with cervical facet joint pain, basically neck pain emanating from the facet joints, and a disc, actually two discs. So our first procedure will be to get down to her facet joints and deaden the pain nerves. This procedure is called a rhizotomy, but we do it differently at Deuk Spine, and we call it the Deuk plasma rhizotomy. And the reason it's different is we use a more powerful energy source. And Monica, can you zoom me in or get me closer? Bring the fluoro to the ceiling. I want to see the lateral masses better. Shot? So our goal here is to deaden the pain nerves.
Want me to magnify it, or are you close enough there?
Whatever you can do to help me see better, but that's almost good enough. Not quite, but almost. Shot? All right, I'm sitting right over the lateral mass of C3. And I'm feeling a lot of bone spurs from her facet joints. Shot? I want to be a little bit more lateral. I mean, there is a massive amount of arthritis I'm feeling here. Shot? Shot? Just got to get it perfect. If you don't get to the right spot, you're not going to eliminate the patient's pain. The key is to be in the right spot and to deliver enough energy to the nerve, pain nerve, to kill it. The name of the pain nerve is called perfect. The name of the pain nerve is called the medial branch of the dorsal ramus. Is that me? Shot? Yeah, that's really good right there. Medial branch of the dorsal ramus. And we got 5 minutes maximum, Dr. B. Let's get the team ready to flip her. The medial branch of the dorsal ramus is the pain nerve that innervates the facet joints. And when you have a facet joint injury, you get arthritis of your facet joint, and then you get pain with movement, particularly rotation and extension of your neck. When you rotate your neck to the side, when you extend your neck up, that's when you get the pain. Shot? All right, that's better. Let's see, I want to verify our position. Be just a tiny bit more lateral. You guys see the lateral mass there?
Yes, we do.
All right, so I'll tell you, the lateral mass looks like a little, kind of a square bone. I'm right at the, below the waist, which is where you want to be at the waist. And the thing about our procedure, the Deuk plasma rhizotomy, that's different, is we're wanding our probe. You can't do that with an RFA probe. Doctors that do radiofrequency ablation cannot do that. They cannot wand the probe. They can only place it and hope that where they put it, it's where the pain nerve is. The problem is, a lot of times it's not. So you're going to miss the pain nerve unless you do this technique that we developed here at Deuk Spine. Shot. All right, I'm happy. See where that probe is, Henry? I want you
Yes.
to take that screenshot right there. perfect placement, absolute perfect placement. If you could save that for the DPR cervical for the website, right there, that one picture on the x-ray right now.
Copy that.
And I want that on the website for the cervical part. I'm
You got it.
working on the DPR right now, and that would be a perfect picture to show perfect probe placement for the medial branch of the dorsal ramus.
Of
for
course.
Cervical.
Not a problem.
All right, so save that shot. All right, working my way down. I've got just one more to go. I want to get in the right spot. It's very important you position yourself exactly where you need to be before you make a burn. We're using radio frequency energy to do the burn. Shot. Oh, that's nice. Shot. All right. Shot. Uh-huh. And the last one. Now, unlike the DLDR, this procedure actually hurts the patient. I mean, they feel pain. And that pain will last for a few days, maybe even a week in some patients. All right. Feel good about that.
Please. Thank you.
All right, we're done. Let me show you the incision. Can you see this, Henry?
Yes, sir.
The whole surgery is done with a 4mm incision. So tiny, bloodless, and we're finished. So we're gonna now turn this patient over under her back, and we're gonna do 2 discs because she has 2 herniated discs that need to be repaired with the laser. So that's next. Thanks for joining us. If you have questions, bring them up for the next surgery. I'll be happy to answer them. But you've watched the Deuk plasma rhizotomy for cervical facet joint pain on the left side of the neck. Thanks, Henry.